Hi, my name is Dr. Anthony Verstandig. I'm an interventional radiologist at the Shaare Tzedek Medical Center, Jerusalem, Israel. Over the last 36 years, I've treated about 4,000 patients with varicocele, varicose veins of the scrotum, causing infertility or pain by catheterization and embolization. In other words, placing a small tube in the veins and blocking the problematic veins from within. I'd like to give an explanation over the next 4 minutes using a simple diagram, after which you will understand how varicoceles are formed, how they can affect fertility or cause pain, and what is the principle and the results of treatment. Let's go straight to the illustration. Here we have the abdomen and the legs, right and left. The testicles are situated in the scrotal sac between the legs rather than in the abdomen to allow some cooling, as production of healthy sperm requires a temperature of 34 to 35 degrees Celsius, which is slightly lower than the normal body temperature. Like every organ in the body, blood is supplied through an artery and returns towards the heart in veins. The testicles are unusual in that each one has two systems of veins rather than one. One system flows directly towards the pelvis, joining with other veins and eventually reaching the heart. This system is not involved in varicocele formation. On each side, however, there is an additional vein that drains blood vertically to join the major veins of the upper abdomen in the region of the kidneys. The reason for these strange veins is that in the male fetus, the testicles do not form in the scrotum, but originate in the region of the kidneys. During pregnancy, they slowly descend to the scrotum, each dragging a vein with it. These veins are called the spermatic veins. When the testicles reach the scrotum, they develop connections with veins in the area, resulting in the first system which I described earlier, and as a result of this, each testicle now has two systems of veins. The spermatic veins are problematic, as they are long and vertical and must drain blood against the force of gravity, from the testicles below upwards towards the heart. To ensure this, there are one-way valves within these veins that open to allow blood to flow upwards from the testicle, but close to prevent flow in the opposite direction. The purpose of these valves is to prevent blood at body temperature flowing down from the abdomen and warming the testicles. A varicocele occurs when these valves malfunction, allowing blood to flow in either direction. During sitting or standing, when the vein is vertical, there is reversal of the normal direction of flow, allowing blood from the upper abdomen to flow down to the testicle. In addition, the flow from high in the abdomen generates pressure, which eventually causes permanent widening of small veins above the testicle. These swollen or varicose veins are called varicocele. Warming by the varicocele can interfere with the process of sperm manufacture in the testes. Although varicocele is commoner on the left, even if it's only on one side, it can affect both the testicles. The warming can affect the number, the motility, and the morphology or shape of the sperm cells, and in addition, the quality of the genetic material or DNA. In addition, the pressure on the walls of the dilated veins can cause discomfort or pain, especially after prolonged standing or exercise. It's important to know that most people with varicocele have no problem and the varicocele does not need to be treated. But on the other hand, amongst people with infertility and problems with sperm quality, it is a common finding. The treatment of varicocele is to block the spermatic vein close to its entrance to the scrotum to prevent the flow of warm blood from the abdomen to the testicles. Since there are two systems, one of them can be closed with no damage to the testicle. This can be accomplished by inserting a tiny tube into a superficial vein, guiding it to the lower spermatic vein at the level of the groin using X-ray fluoroscopy and blocking the vein from within. This is called embolization. Alternatively, the varicocele can be treated by an operation through a small incision with exposure and ligation of the veins. According to the medical literature, after treating varicocele, we can expect a significant improvement in sperm parameters after 3 months in 70% of patients and a natural pregnancy rate of up to 40%. In addition, there is evidence that the results of IVF are improved after treating varicocele where this is relevant. Well, that's the end of the explanation. I hope it helped you understand something about varicocele, and I'll be happy to answer short questions sent to the email address below.